ส่วนไหนตัวนี้ซ้าย
ดับเบิลสกรีนหรืออะไรอย่างเงี้ยแล้วก็กดสไลด์โชว์ได้ไหมคะนี้โอเคอันนี้แบบนี้ได้แล้วใช่ปะไปต้นมันต้องให้ไปเยอะนะบางทีสไลด์ของพี่เยอะอ่ะนะ
โดยปกติparticipantเขาจะไม่เห็นแบบนี้
เขาเป็นไรเราอะ
หมายถึงว่าเขาจะเห็นสกรีนเต็ม
yes อ๋อเราอยากเห็นเขาโอเค
ตรงเนี้ยกับตรงเนี้ยมันจะบังเราเอง
นั่นแหละแต่ว่าต้องไม่ให้บังพี่ไง
อาจจะต้องช่วย
เพราะว่าพี่ต้องอ่านสไลด์แบบนี้โอเคไหมคะมันจะมีบางข้อความที่สไลด์หายถ้างั้นพี่ก็เอาเต็มจอไม่ต้องเต็มจอใช่เอาเต็มจอใช่ไหมเอาเต็มจอค่ะอย่าไม่เห็นเขาต้องไม่เห็นเขาก็แบบเดิมเมื่อกี้ก็แบบใช่ไหมต้องไม่เห็นเขา
คือถ้าจะย่อเลยก็หายไปเลย
หรือว่าย่อไปได้ตรงไหนก็ได้แต่ว่าเอกสารพี่มันเต็มจอไงโอเคค่ะเอาแบบนี้เลยค่ะ
มอใช่ไหมที่ไปซ่อมแบบที่มอใช่
ใช่
โอเคขอบคุณมากจ้างน้องฝนโอเค so now the problem solved okay we gonna start our topic for today today we gonna talk about two subjects. The first one will be the coronavirus 2019 or COVID-19, and the second subject that we're gonna talk is about hand, foot, mouth disease. For the learning objectives, I hope that by the end of this session, participants will be able to, the first one, explain about the COVID-19 and hand, foot, mouth disease. The second one should be explain about the control measures and preventive actions on the COVID-19 and hand, foot, mouth disease. So let's get started. The first one, what is a coronavirus? So I hope that all of you already know about this disease. It's a novel infection. It can be communicable. The coronavirus is a new strain in the coronavirus family. It was named 2019 novel coronavirus, or sometimes we call SARS-CoV-2 or COVID-19. The COVID-19 outbreak started from the city of Wuhan, Hubei province of China in December 2019. Right now is just like a global crisis. On this disease, let's see that the COVID-19 was announced an emergency for the healthcare system on January 30th, 2020, and was declared a global pandemic by the WHO, or World Health Organization, on March 11, 2020. Let's see the world map. You see, it's a red, is almost red of the world. It's a global crisis. Okay, let's check with statistic. I got this information from the Worldometers info on the coronavirus. If you see the global daily infection is very high. I try to make myself update with the information last updated yesterday morning. Right now, our world has been attacked by the coronavirus. Right now, have the more than 15 million. See, more than 15 million persons, and each day they have a new cases for around 30,000 persons. And the dead person is more than 330,000. And on the active case, currently infected patient is more than 5.3 million. And 99% of this is in my condition, just only one in the serious condition. Also have the close case. Some maybe around 10 million was recovered, and 600,000, more than 600,000 death is a very crisis for our world. Okay, let's see. For the top 5 country report coronavirus cases. Last updated is yesterday morning also. The first country with the first rank is the United States. With the case, total case more than 4.1 million person, and still active cases more than 2 million persons. The second link will be the Brazil. And the third one is India. The fourth is Russia. And the fifth right now is South Africa. This is on statistics about the coronavirus cases. For Thailand, we rank in 104. Total cases in Thailand is 3,269, and have active case for 106 persons still in the hospital. We have a new cases about the 8 persons. In 8 persons, 4 from Egypt, and retainer from Egypt, and 2 from Sudan, and the other 2 from the United States. This includes the 2 new cases last week also. The Egyptian delegation, including a military official, confirmed to be infected with the COVID-19 when they broke quarantine rules during their stay in Rayong. And the other one is a girl-years-old Sudanese girl who tested positive, and her family who were reported isolating at the Bangkok condominium. These are 8 new coronavirus cases reported yesterday morning. Right now, it will be maybe 57 consecutive days without no locally transmitted infection case in Thailand. The coronavirus pandemic has occurred at the serious level in many parts of the world. It's still a global crisis that you see the statistic. Therefore, the cabinet formally approved the extension of the emergency decree nationwide until July 31st, as proposed by the Center for COVID-19 Situation Administration in Thailand. Let's check about the virus. I try to propose you about the table that differentiate between the three viruses. The first one is a SARS-CoV. It's a severe acute respiratory syndrome associated coronavirus or SARS-CoV. The second one is a MERS-CoV, Middle East respiratory syndrome coronavirus. And the third one is a COVID-19 or coronavirus disease 2019. Okay, for the outbreak, if you see this is come from the same family, coronavirus. Let's see the feature. It look like the same. For the SARS-CoV outbreak, it happened in Asia in February 2003. For the MERS-CoV, already happened in Saudi Arabia in September 2012 and spread to several countries, especially in the Republic of Korea in 2015. For the COVID-19 that I told you, it started in December 2019 and right now spread globally. All three, it had the same transmission route by the respiratory droplet or maybe close contact with one another within the 6 feet. This is a transmission route. For the symptom that we can see is involved with the respiratory illness. The children or the person who get infected will got the ranking from mild symptom to the severe unit. They have a fever more than 38 degrees Celsius, or chill, cough, shortness of breath or difficult breathing, fatigue, muscle and body aches, headache, no loss of taste or smell, sore throat, congestion or running nose, nausea and vomiting, or some case we're gonna see the diarrhea. All of these need the universal precaution for isolation necessary. For the vaccine, right now, currently undergoing clinical trial from the many university and many the pharmaceutical companies. Some may be on the second phase of trial, but some on the third phase of trial. We see with the picture, okay, about the key symptoms: fever and tiredness, continuous cough, lot of taste or smell, and important thing is breathing difficulties. Hello.
Hello.
Okay, so you
One
still
question,
following,
please.
right? You still following me, right?
Yes.
Yes, ma'am.
Yes.
One
Yes.
question.
Yeah, okay.
One
So
question
we're gonna
from
go
Philippines.
on.
Yes.
Huh? Yes.
One
we're gonna
question from Philippines. Is it okay?
Although right now you have question there, please.
Yes. This is Romeo from Philippines.
Okay.
Just a clarification on COVID-19. The name of the disease is COVID-19 and the type of virus is SARS-CoV-2. Am I right?
You mean, yeah, they said they have many, it has many many names. We
Yes.
can call coronavirus 2019 or the COVID-19 or SARS-CoV-2. It's the same. You mean
That is
I
the name
answer
of.
your question?
I will repeat my question. The name of the disease is COVID-19 and the
Yeah.
name of the virus is SARS-CoV-2 or the novel coronavirus. Correct? Am I correct, ma'am?
It's the same. It comes from the corona family.
Yes, it came from the corona family, but the name of the disease is COVID, coronavirus disease.
Yeah, COVID-19. COVID.
Yes, okay.
COVID-19.
Okay.
Yes.
Thank you.
Okay, yeah, you're welcome. Does anyone have any more question on this?
No.
No, okay, so let me go on. Is okay?
Yes, it's clear.
Okay, so let's go with the control measure. The control measure. Okay. If you watch TV or follow the WHO message or news, many countries struggle with this disease, and they have their own strategy to manage the COVID-19. For Thailand, in my opinion, I think there are so many contributing factors that make the Thailand success in the control measures. The thing that the first thing that I think about is government. The second part will be the public health ministry and medical experts. And the third will be the collaboration of the people. For the government, they since in March 12, if I recall, in March 12, 2020, the Thai government ordered the emergency decree, and we have just like a state quarantine and local quarantine, and also we have curfew. Do you know curfew? The time that limited people at home and go out with the special time. We have a curfew, and also they have lockdown measures, lockdown the city. Have some inter-provincial travel restriction and ban on the international travel during the crisis. This is the disease control measure that government try to protect the Thai people from getting the infection and try to reduce the spread of the infection. For the isolation, isolation is mean the separation of persons who have a specific infectious illness from those who are healthy, and restriction of their movement to stop the spread of that illness. For the quarantine, refer to the separation and restriction of movement of the person who, while not yet ill, have been exposed to an infectious agent and therefore may become infectious. So you know about the isolation term and quarantine term. These apply in Thailand. Besides the government order the emergency decree, many organizations, many parts of Thailand, especially the public health ministry and medical experts, try to work hard for this. We need to take care with each other. A lot of donation from the people in Thailand, some donation from the some budget from the government, some from the private sector, some from the NGO, and some from the loyal family, and also some money from Thai people. We donate for medical supplies that we need to use. For example, about the mask, about the gloves, about the PPE, about the glove, and so many things. Because medical expert or medical healthcare professional need to set up the healthcare system and handle with the disease, handle to fight with the disease. So many sectors in Thailand cooperate to work with each other to fight with the COVID-19. And when we receive, on the medical expert and healthcare professional, receive some encourage, some in Thailand we call กำลังใจ from people around the country to say thank you. Government order Thai people to stay home, and go out just within the duration that allow, and need to use or wear the face mask when go out to the public. This is the other one is make the contribution to the Thailand success in control measures. It's about the people awareness. Awareness is very important thing, and people cooperation with the government regulation. Thai people realize the importance of practicing social distancing and wearing face masks and regular hand washing. So the best way to prevent illness is to avoid being exposed to COVID-19. So how can we do about this? avoid being exposed to COVID-19. So this is why we need to, during the crisis, we stay at home. Go outside just only in case to buy things, to go to the market or supermarket only in the short period of time, and then come back home, take a shower, clean clothes, and clean up. So people be more aware about the good personal hygiene. And they concern more about the hand washing. Hand washing is very important because we come out, we need to think about, right now we fight with the unseen pathogen, we fight with the unseen living creatures, and we need to know how to protect ourselves from the disease. It's just the thing that is not too difficult to do. For example, hand washing. We need to wash our hand when we touch with the contaminated object or surface. Just clean hands frequently with soap and water. WHO said that should be at least 20 seconds. Okay, and the adults should help the young children to do the right technique of hand washing too. If soap and water are not available at that time, you can use the alcohol-based hand sanitizer. With the alcohol, at least 70% should be good for health. When do you wash your hand? When should the right time? It's very important to wash your hand before eating and preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing or sneezing, after handling your clothes face covering, after changing diaper for baby, after caring for someone sick, after touching animal or pet. This is the time. This should be the right time for you. If you do this activity, you need to pay attention and wash your hand frequently. When you this is just like a coughing etiquette. You need to cover your nose and mouth with a tissue when you cough or sneeze, then throw the used tissue in the trash can. You can use the inside of your flat elbow, cover your mouth too when you cough, and you don't need to spit. Do not spit. Wear a cloth face cover or face shield when around the others in the public area. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid personal contact, such as kissing or sharing cups or eating utensil, the same utensil with sick person. Clean and disinfect frequently. Touch surface and object daily, such as clean the doorknobs, light switches, table, countertops, phone, keyboards, toilets, faucets, and sinks. And don't forget to practicing social distance at least 6 feet of distance or at least 2 arms length from other people. We will come to the new normal lifestyle. Be more aware about our health. To be a good health is the valuable asset. It's good more than you have anything. The good health is very important. So when the world was attacked with the unseen living creature virus COVID-19, people more aware of their living. They come up with the new normal lifestyle. When they go out, should use the cloth face cover, do the hand washing often, practice the social distancing and limiting activity as necessary only do. Okay, this is the message from the WHO about the poster that I got from the WHO website. Protect yourself and loved one from coronavirus. How to do about hand washing, cover when you are sneeze, use your flat elbow. Okay, so many things that I already told you earlier. So this is about the COVID-19, and I will take you to the tour to the Early Childhood Health Care Center at the Faculty of Nursing PSU. This is our child care center. What we did here. Okay, if you see the picture, we have an area of the hand washing at the entrance. On the children come, they have to take their shoe off and put in the box, in the shoe corset like this, and then they have to turn on the faucets, clean their hands and their foot, okay? And we have a dry towel for them to clean. And then after that, they will walk upstairs, up the stair, and go to this area. For right now, when parents take their children to the child care center, they have to sign their name. And also when at the end of the day, when they come back to pick up a child, they have to sign the name also. This is the area need for the parent to sign their name. And also at this gate, they are the staff that they practice with the they have to wear the mask also. They need to check every child at the gate for the temperature check-up. If the child got a fever, they will allow the allow the parents take the child at home. So at this area, they need to check the child temperature before enter to the center. And also we check for we do the health screening also for the rash, for all infection, for the rash, for the to detect about the maybe measles, about the hand, foot, mouth disease before enter the gate. No, we need to do the health screening and temperature checkpoint area at here before allow the children go inside the center. And in the room, we do the social distancing also. We make the point on the floor and allow each student sit how can I say sit far each other, at least 6 feet, you know. So the child sit not nearby, sit far from each other, and they can pray.
As much as possible, right?
As much as possible.
On time.
Yeah, right for the kids. And also when you see the on the floor, we do the step, okay? A step for the practice the social distancing, okay? On the on every area, in the child care center. And this is our staff at the child care center. She asked for the child to do the social distancing. Need to stay at the at the footprint on the floor like this. Okay. And also we give some information or the message about the COVID-19 to the child and to the parents. Also, the child already do practice the hand washing before they eat their meal or lunch, their food, and after they finish their eating time, they come to the restroom and wash their hands, and then use the individual towel to clean, to wrap their hands. Okay, this is we do this in our child care center. Yeah, this is our environment at the center. Okay, so I already finished about the COVID-19. I don't know. This information that I give to you is a cover on the things that you want. Before move on to the new subject, I would like to tell you a bit about the teleconference that we have in Thailand right now during this week from 20 to 24th or today, 4 days. We are so very happy Thailand and New Zealand, two countries, has been selected to be the two countries that gonna share about lesson learned about how our government, about the medical expert and on sector cooperation, the way that they can handle or control the COVID-19 in Thailand. That I already told you we think about the Thailand success that I told you before. So this is everybody responsibility, not only the just government, but government, private sector, NGO, university, family, everyone need to be careful and alert with the disease, and we need the collaboration. We need cooperation from the people. And this is draw from the, if we look back at the, if we look back in the 2000, or maybe look back until the first conference of the WHO talk about the community building capacity. You're gonna look at that why we need to empower the people, why we need to work together with the many sectors at local level and state level to fight with the COVID-19. So the personnel, many sectors have a teleconference and will summarize the successful strategy that the Thailand can handle the COVID-19, and also be ready if they will have the second wave of the spread of the disease. So we need to learn about it from each other. For the topic that they said about it includes with the 9 subjects. They're gonna talk about the strategy, how to cooperation or management or do the surveillance or do case investigation and evaluation at the level, at the country level, and also try to do the communicate about the risk and people cooperation, do the surveillance, do the case investigation that I said, and also talk about with the how to do the state quarantine and local quarantine for the export cases, and how to work with the lab testing, and the important that is about the sharing knowledge and work about the innovation and research, and do so many things, because when when Thailand was hit by the COVID-19, its impact with the people lifestyle, you know, we cannot go out at the same that we do. We need to have a special time to go out, and we need to wear the mask that we are not used, are not familiar. For some people, not familiar to wear the mask when they go outside. So on that time, most people, I guess most people feel stressed and some may be depressed because they have to stay at home, cannot go outside for social gatherings. And if we look at with the COVID-19, the impact from the COVID-19, in my opinion, there are both advantage and disadvantage. The advantage that I think people can stay at home, Mom have a more time to stay at home with their children. So they should have a quality of time with their children. They can play with their children. They can make the happy family during that time. I know that at the other side, the COVID-19 impact to the economic. People cannot go outside for working. They need to work from home. Some person maybe have to drop from their work. They don't have much money. So in Thailand, government have the program to support for this group of people and support the money for all vulnerable people. So if I see there from the impact of the COVID-19, I see both sides, both advantage and disadvantage. It's up to us to look at the situation. If we look at the situation and say we work together and we can fight it, we can do it. It's up to the mindset. It's up to the resources that we have, and we can use it at the best. I hope we can fight the COVID-19 together. So, any question now?
Yeah, hello.
Okay, please.
Oh, thank you so much for a wonderful presentation. It's so beautiful. But I really want to commend Thailand on their contributing factors, because that has really made their cases to be so low as 3,000. But please, I want to find out, these essential workers, how do they get paid? Because here in Nigeria, we have a lot of issues with essential staffs not being paid, and sometimes they threaten to go on strike. And so we have this COVID on the increased size. As I speak today, we have it 35,000, and then 20,000 active cases. Now, it's really on the increase. So yes. I also want to ask, in Thailand, how is their treatment protocol? How do they treat their infected patients? Thank you.
You asking me about how Thailand achieved, right?
Yes. How were they able? How were they able to do it, to achieve all this? Because it's very low, 3,000 plus. It's so low.
Yes, very low. So
very low.
Yeah, thank you very much for for your questions.
Thank you.
Let me explain about the healthcare system in Thailand. This is very important. That, as I said, the good health is one valuable asset. It's variable assets. So if the government pay attention on the health of the people, they gonna build the good infrastructure in the healthcare system. In Thailand, we are very lucky. If I told you, we have, if you remember, do you know our King Rama the Fifth? His name is King Chulalongkorn. Do you know his name? If you look back at the Thailand history, you will gonna know the King Rama the Fifth is the person who build the own infrastructure medical system in Thailand. It beginning far away, maybe more than how many hundred years. Okay, because the first one, the leader of Thailand at the previous time, the King Rama the build the healthcare system, and he create the sanitation. They have just like develop the healthcare system. From there, they use their own money, royal family money, and help the people. And then until now, we have the strong. I can say that we have a strong public health system in Thailand.
Yeah, sure. I know.
Yeah, we have a strong public health system in Thailand. We have just like a universal coverage for the Thai people also. Yes, universal coverage for the Thai people. So I mean, it involved with the vision. I will talk about the vision. About the vision of the leader vision is very important. And they have to set their goal that how to help the people get healthy. And they will use their resources to provide the all resources they have to the people. So maybe need to think about the how to establish the good health care system in your country.
Let me share.
Okay.
Yes.
Let me share.
Thank you.
Yeah, you're welcome.
During the COVID outbreak, we closed all restaurant, department store, pub and bar, and school, and on education setting, most people stay home and work from home. You see,
yeah.
Whenever you go outside, people have to wear masks. And we use the policy of curfew, right?
Yeah, policy of curfew.
And we limit transportation between provinces. Yes.
Okay, so you have any question?
Can you hear me?
I have a question.
Yes.
Yes. I explained about our policy.
Policy that I mentioned.
Yes. Why we success?
Yeah, why?
COVID-19 control in Thailand, because we use a lot of
strategy.
procedure, right? A lot of
Yeah.
strategy. Okay.
That,
our people cooperate with the policy of the government. Success this, we put a lot of strategy and effort to fight with the COVID-19.
Yes. So that I told you, we have a the Thai government have a control measure, many strategy. At the state quarantine for the person who come from foreigner country have to be quarantined in the quarantine places, Bangkok, or maybe at the hotel or places that government provided, and also have just like a local quarantine also. And we have to do so many things about the restriction about the inter-province travel and lock down the city.
And we put a large number of budget to fight with the COVID-19.
Yes. Yes, so we have many people, when the people be aware or alert with the COVID-19, they concern about their own health and they try to cooperate how to take care themselves and obey the policy. So it means that this is the way, that's why I said about the collaboration from all sectors, include the government part, private sector, NGO, university, and Thai people. And this is that I already said, this is the everybody responsibility. They need to responsibility for their own health. They need to take care and receive the support from a lot of organizations. So this is why Thailand can control the COVID-19 with the lower number, just 3,269 persons, and have just only 106 persons in the hospital. And right now we don't have the locally infected case in Thailand. The person that infect just returned from the foreign country only. Okay, and the death toll number just only 58. Yeah, that's the information and statistic that we have in Thailand right now. And we try to when we can handle the disease. This is why the Ministry of Public Health and all sector in Thailand do the teleconference and to talk and do the summary or lesson learned from how we combat the COVID-19 right now in Thailand. And we prepare ready if they're gonna have the second wave of the COVID-19 infection.
Hello.
Yes, please.
Yeah, may I ask, how many people have you tested so far? Because there is an assumption that the more people you test, it's probably the more cases you will have. So
Okay.
if you test little, you will tend to have lesser cases than countries that test more. So I don't know so far how many tests have been conducted versus the number of positive cases that you have registered in your country.
Okay, so right now we have just like a testing lab. Some export cases don't have a symptom. They need to isolate themselves at home and check with their health, check their own health. But some case already, some case are in the quarantine area. Some test the positive at the first time, but some find the second time when testing. Everybody that come from the foreign country, everyone need to stay at the state quarantine that government provided at least 14 days. And on site there are medical experts to do the testing lab.
Okay.
Yes, we do like that.
Okay, actually, what I mean is like internally, not actually targeting foreigners or so, but like on a daily basis, how many people is the government targeting to test? Or it is, for example, like voluntary testing, or you are doing mass testing of your population, not actually targeting foreigners, but your citizens. What is the rate of testing in your country? Or how many tests have you conducted so far since the outbreak?
Yeah, we do the just like everybody have to do the just like take the specimen from the nose and the throat, okay, and do the viral culture and do the PCR, and for the statistic that you asking, there are at least 280, more than 280,000 that we need to surveillance. Is a case. Okay.
Did you get the answer?
This is do you want to know the accumulate number, right, of the case COVID-19 that has been being tested, right?
Exactly, yeah. Because you know, some people can have the virus and they don't exhibit any signs or so. So they can be in the community, you know, with the infection, but they're actually not showing any signs and symptoms of the infection. So if you don't do testing, you will probably have a lesser number compared to countries that are doing a lot of tests, you know.
Yes. And some person can we can find on the first time positive, but some don't have symptom, or we call a symptomatic person that they carry the disease and can find on the second testing. But everyone have to stay at the state quarantine at least 14 days.
So from our information, we found that less than 1% infected with COVID-19 after testing in Thailand.
Okay.
I have a question.
Yes. Do you have any question?
Madam, I want to ask one question, madam.
ใครก่อนใครก่อน
Me, Sonam Choyje from Bhutan, madam.
Okay, so what's your question, please?
Actually, in Bhutan, we have, for the past 1 month, we let the people who are coming from other countries to quarantine for 2 weeks only. But after 1 month, we let them to quarantine for 3 weeks. So what we have seen is like a few of them, after 21 days, they have tested positive. So I feel like, 2 weeks is not that effective enough for COVID to do quarantine. So I want to hear how, is 2 weeks quarantine for people who are coming from abroad is enough for you all? And I want to hear from other countries also how quarantine is being done. Actually, in Bhutan, we have total cases of 92. Now active cases only of 7 numbers. So we don't have a local transmission so far.
เขาบอกว่าของเขา
All are imported cases actually.
แต่ของเราควอรันทีนแค่14
At least 14 days. At least 14 days. But,
Yeah,
and
WHO
also,
guidelines. Actually, WHO guidelines says we should do quarantine for 14 days only. But we have noted few cases after 14 days also, madam. So I feel like 14 days quarantine is not enough.
okay, I understand you. At least 14 days for the quarantine. But the person that has been exposed to the disease, the government, the health personnel will follow, will check their health status. Follow this.
Let me share some. After 14 days quarantine, people have to observe themselves at home. You know, if you have more than 14 days quarantine, it means that you need a lot of budget to do that. So we cannot provide for all people in Thailand. State quarantine is free.
Yes.
For everybody. See? We know
Okay,
that
madam.
some cases can occur after 14 days, maybe 28 days. We also have that evidence.
Okay,
But,
madam. Thank you so
They
much.
need to stay home and check themselves.
Yes.
If they have some respiratory illness or some health problem, you can come back to the hospital.
I have a question, please.
Yes.
Emily, right?
My name is Amani. This question is there a possibility of reinfection with the coronavirus after recovery? What about this?
Yes, ma'am.
Sorry. Would you please speak slowly?
Yeah. Is there a possibility of reinfection with the coronavirus after recovery?
Pardon?
You mean the
Reinfection.
you mean about the reinfection, right?
Yeah, after recovery.
For the reinfection, I mean some person who has been exposed with the disease, they have right now we don't have vaccine. Okay, right now we don't have vaccine, still on the trial. So if the people exposed to the disease and at the beginning they don't have any symptoms, but if their immune system is not quite good and they get worse, they have to go to the hospital. Right now we have just only 1% of 1%. 1%, maybe less than 1% of serious case in Thailand. Right now, just have only 106 person has been hospitalized right now.
And for reinfection in Thailand, we have no case.
No case.
No cases in Thailand with reinfection.
Okay, thank you.
Yes.
Well, talking about the reinfection, we have to take note about the communication of CDC in the USA, Atlanta.
Yes.
And they say that is at this moment is not possible consider reinfection because the virus need a new virus strain that is so early because they need to contaminate a big part of the community of the human for change the characters of the virus. But talking about the coronavirus situation, I mean, all the people, all the take decisional people is concentrated in this moment in talking about the test, how to apply tests for more people, and how talk about the different treatment that we can apply since different schools that we can read. But I guess that the topic is talk about how to prevent it, because there's a unique thing that we have in our hand, prevent it. Before the vaccine is nothing possible to prevent it. The unique way is apply the restriction of the contact between us, they clean our hand. I try to apply every care that you are taking us, because one point important is the participation of the community. We need to make our effort to try to obtain the participation of the community, obtain the advice that we are doing, giving them, because we have any at this moment nothing more to prevent it, only apply these advices.
Yes, for right now, we the activity or the action that we can do to prevent getting the disease, just practice social distancing. Just wear the mask every time you go out to the public, or maybe you need to do the hand washing. That is the basic things that we need to comply with, we need to do. Okay. So any more questions, please?
I want to ask, what are the treatment protocol used in Thailand for cases in COVID-19?
What is, sorry.
What are treatment protocols used in Thailand for cases with COVID-19?
Do you mean what kind of treatment?
Treatment protocol or medication used in Thailand.
Medication.
Medication guideline. Oh, we use we comply with the CDC and WHO and apply this at apply the knowledge, okay, and apply the guideline into the each hospital. We have a UN also, UN guide, the guideline from the United Nations and from the WHO and from the CDC. You mean you want to look at, you want to see the guideline?
Yes.
Okay. in my latest slide, I already post about the UN guideline. You can go and check with that, because there's a lot of guideline for the healthcare worker and do so many things. It's a lot of information in the UN guideline. About the, you mean about the medication, right? They use antiviral. At the first time they use just like DDC, AZT112, or so many medication about the antiviral disease.
Can go on.
So any other question?
Doctor, I have a question.
Yes, please.
I saw about the social distancing in the daycare. It seemed like the children ignore to play each other. In this regard, do you think that it impact to the psychology or not in the future? That is one thing. And how you can control the children, because children is very active and sometimes they want to play together rather than to sit alone and just play with toys. So
yes.
How can you deal with this, and what is the turn to the first question, that it can make children like to start to ignore to play each other and start like social ignoring or something related to the psychology of the children.
You mean the how to manage, right? How to manage in the daycare, right? Okay.
Yes.
At the beginning, I already told you about when every child go to the child care center. At the gate, we check about the temperature, the child temperature. If the child got the running nose or high fever, we will tell the parents to take the child back home. So we look at the gate. So no child have a running nose.
It's not.
And that's not the point, right? You mean
it's not the point.
The point is how the children playing together, right?
Yeah, because I saw a picture that you separated the students from each other, and how to from playing together, because they mostly very active.
Yes. I understand that is the normal life of a child. They play together, but the staff in each room have to take care, because the first thing we said that we check the child temperature before enter to the child care center, right? So no child have a fever. So they don't have any fever. So they go inside, but they still praying. I would suggest for myself, a child should wear the kid mask. If I suggest, okay, I would suggest the child wear the kid mask when they play together. But for any activity, I mean, they do the hand washing. They apply with that, they do the hand washing. Yeah, in case they work, they play together, we sometimes we cannot control at that situation. We cannot control because this is the way of the child right? They have to play, they have to do so many things with friends. But if my suggestion, I would love to see the child wearing a mask, a kid's mask. Okay, that should be more protective, more proactive way to control spread of the disease. I mean, some child care center already apply that. Use the kids mask, yeah, kid wear mask, but some center are still ongoing to do this. Any more question about the COVID-19? If right now you don't have any question, or maybe ask me later. Let me continue to the second subject about the hand, foot, mouth disease. All right. Okay, about the hand, foot, mouth disease, it is another living creatures. The virus, okay, is a common infectious disease. It affects mainly to the children under 5 years old. Okay, for the hand, foot, mouth disease, caused by at least two pathogens. The first one named Coxsackie virus A16, and the other one is enterovirus 71. About the Coxsackie virus, Coxsackie virus is a single strain RNA virus. Is a member of Picorna virus family. And Coxsackie virus is a subtype of enterovirus. Coxsackie virus have two types. The first one will be Coxsackie virus type A, and yet the other one is a Coxsackie virus type B. For the hand, foot, mouth disease, is caused by Coxsackie virus type A16. Is most contagious during the first week of symptom. The children who infected by Coxsackie virus will have fever, respiratory illness. They cough, they have a sore throat, and feeling tired. Okay, the sore area seen in the mouth that develop about in 1 or 2 days after the initial fever, and develop into small blisters that often isolate. So it's very painful. And also develop a rash that itches on the palm of the hand, the sole of the feet, the buttocks, and the genitalia. Some children show or develop conjunctivitis. The symptom will last around 7 to 10 days. Okay, and the person are most contagious for about a week after symptoms begin, and may be mildly contagious for several weeks. Okay. And the other pathogen is enterovirus 71, EV71. you can look more about the article that I post. It talk about the enterovirus infection and neurological complication. I mean, if compare, okay, I showed you with this first. Can we open this? Show a bit for the journal. Can we show this a bit? That's it, the website that I show you, it talk about the enterovirus 71 infection. And it impact with the neurological system. And this is a huge complication if caused by this virus. I mean, the most common cause is from the Coxsackie virus, and the second one from the enterovirus 71. But the impact from the enterovirus 71 is bigger than from Coxsackie virus. Okay, for this you can check with the in detail. Okay. You can have time to read with the attached article. Okay, so for this table, I try to show you about the difference between the Coxsackie A16 and enterovirus 71. Okay, the way to control is mean the cut off the transmission route, especially is transmit by the fecal oral route, and also with the through the respiratory aerosol from stool, from saliva and blister fluid. And the incubation period is allowed for the Coxsackie virus is around 1 or 2 days. Some said with a range of about 1 to 5 days. Different from the enterovirus incubation period around 3 to 4 days. Okay, it is occur most in Southeast Asia in summertime and in fall. What about the symptoms? Okay, the children who get the disease period with the fever, poor appetite and feeling tired. They have a sore throat, painful blister in the mouth, tongue, gum, buccal mucosa. They cough, they have a skin rash, blister on the palms of the hands, sole of the feet at the bottom, and genitalia, and some maybe develop conjunctivitis. The symptom will last around 7 to 10 days. The complication that I mentioned from the Coxsackie virus A16, it infrequently. They show just only temporary fingernail or toenail loss, or maybe some experience with chest or abdominal muscle pain. Is a relatively rare complication from the Coxsackie virus. But if the pathogen is the enterovirus 71, is a higher incidence of neurologic involvement. Some children may experience with the conscious change because they got some complications such like aseptic meningitis, encephalitis, or acute polio-like paralysis or myocarditis. For the treatment, it is self-limited. No treatment is required. We need to provide just the supportive treatment. The symptom will resolve in about 10 days with no serious complication. We provide just only the supportive treatment. For example, if the child have a fever, we gonna do the tape span. Okay, before we go that, let's see with the picture. This is the picture of the child that who experience with the or who get the hand, foot, mouth disease. Let's see, they have a bitter spot in the palate, in the hard and soft palate, at the tongue, around the mouth like this. Let's see at the palm, at the hand and the palm and the foot and the leg, and some develop conjunctivitis and have a fever, something like this. Okay, so for the nursing care, what we gonna do for this child? Okay, if they go to the center and at the gate, we already do the health screening. And when we check with that, they got the high fever, send back home, talk to mom and send the child back home and give the information how parents to take care their child at home. So keep the sick child at home at least 2 weeks, at least 14 days until the blister gone. Let the child rest and isolate the child from siblings or from other children. When he got a fever, do the tape span, okay, and provide a liquid diet such as the cold milk, yogurt, or soft diet, prevent dehydrated, and do the oral hygiene care, do the mouthwash, special mouthwash frequently, and separate personal items such as utensils, towels, and toys, and give him pain relief medication such as the paracetamol. And some doctor may be prescribe Benadryl for them. Okay. Also should encourage do the hand washing. Observe a child consciousness. Some child maybe have got the disease with complication, but some maybe don't have a complication. That I told you. If the foot hand mouth caused by the enterovirus 71 is more severe if compared with caused by Coxsackie virus. So if the child stay at home and parents should check with the child consciousness, and if the child have a prolonged fever more than 10 days and show some frequently vomiting and dizziness, parents should take the child to the hospital to see the doctor. Okay. So for the prevention, hello? Do you have a question, right?
Teacher,
Yes, please.
some of us has problem with the presentation. We cannot see the slides. I don't know who more had the same problem.
Yeah, the slides are not showing.
So what's your question, please? Oh, you don't see the slide? Right
No.
now, do you see it right now?
I cannot see.
Slides is fine from my end.
It's fly to anyway.
อันแรกเลยค่ะไม่ใช่อันนี้นั่นแหละค่ะอันนั้นแหละค่ะ Can you see now?
Yes.
Yeah, I can see now.
Okay.
Yes,
Okay.
Yes, we can see.
Okay, you can see now. Oh, I'm so happy. You can see my note. Yes. For the prevention.
Yes, you can see.
Yes. Let me continue. Yes. Try to avoid contact or direct contact with infected children. Do the hand washing with soap and water at least 20 seconds. Need personal hygienic care. Avoid touching face with unwashed hands. And proper cleaning of the chair utensil. And do the disinfecting about the contaminated surfaces and objects. And mom should take care about the child because the child have some blister in the mouth, so they cannot eat. But we need to maintain and encourage the child take some nutrition or healthy food. Okay, this is the way that we can take care of the child and prevent from getting the disease. Okay, let's check with the hand washing technique.
Wet your hands with water. Apply soap, rub your hands palm to palm, and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub. And then clean around the thumbs too. Rub your fingertips in the palms of your hands. With a paper towel. Wet your hands with water. Apply soap, rub your hands palm to palm, and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub. And then clean around the thumbs too. Rub your fingertips in the palms of your hands and finish off with the wrists. Rinse your hands really well with water and dry them thoroughly with a paper towel. Use the towel to turn off the tap. Your hands are now clean.
Okay, so for the second one,ค่ะเบิร์นทราบแล้วที่ดูตอนเช้ากับพี่อะค่ะไม่ใช่อันนี้ที่ดูในเว็บใช่นั่นแหละค่ะ
Sorry, I have a question as you load the video. Can I ask question, please?
Maintaining hygiene and sanitization is an extremely important step
an
in preventing
adult
infection.
transmit
I'm going to demonstrate the proper ways of hand washing. 7 steps of hand hygiene.
First and then ask question.
Okay.
ที่แชร์เลยค่ะสไลด์ยังมีค่ะโอเคถัดไปเลยเดี๋ยวนะครับเป็นหน้าถัดไปสไลด์ถัดไปค่ะโอเคแค่นี้ละค่ะโอเคแค่นี้ก่อนขอบคุณค่ะ so do you have do you have any question please hello
Yeah. Hello. Hi.
Hi.
Yes, please. I want to know if an adult can transmit the hand, foot, mouth disease from a child to another child.
You mean the transmission, right? Okay.
Yes.
So
from an adult, can an adult carry the disease to?
Yeah, absolutely right. You're right. Yes. Can it transmit from the fecal oral route, right? So if we want to cut off the transmission route, we need to do the hand washing, especially the person who cooking, preparing the food. They need to clean the surface object of the table in the kitchen area and clean their hand, and they need to wear hat and mask and preparing the food. Okay. Adult can transmit the disease to the kid. Yes, you're right. Any more question, please? Don't forget the pathogen. It means the enterovirus 71 or maybe Coxsackie virus. The pathogen can spread in the stool also. So this is why we need to pay attention after 10 days. Still contagious. Okay.
Okay, madam.
Yes.
Okay.
So any question?
One remark.
Yes.
Do you have types like dengue fever combined with the head, foot, and mouth disease in your country?
Do I have what? To have
No. I mean, do you have? I mean, do in Thailand? Do you have a case of combination between dengue fever and hand, foot, and mouth disease?
You mean the combination of the case that have a dengue virus and foot and mouth, right?
Yes.
We have a separate disease. I didn't see a combination in one case. In Thailand, we especially during this rainy season, is a high incidence of the dengue virus infection in Thailand. But the public health ministry concerned about it. We provide, we do just like the insecticide spray, and we do the we call cyanide. We call cyanide that put in the pool or in the basket, and we also give the message to the people, because the healthcare public health system in Thailand, we do have just like a health care worker in each community. We have a healthcare worker in each community, and those person will gonna take care each village. Some maybe take responsibility for 10 households in community, but some may be taking care 12 or 20 households in each community, and they will encourage the people, the community, to know how to prevent getting the dengue virus. Okay, try not to use the net. Okay, and use the net, and encourage children to wear the long sleeve and long trouser. Yes, and although they sleep in the daytime, they have to stay in sleep in the nest also.
The mosquito.
Yes, the mosquito nest also. Okay, so we have a lot of
You know, in Cambodia last year, huge number of dengue fever in our country, a whole country. And in my hospital also have many cases admitted in the hospital. And some cases combined between dengue and also have hand and foot and mouth disease together. And this, the severity is very, very bad to the children. It is unpredictable and the condition change very fast.
Okay, yes. If we talk about the dengue virus, you know, they have some not severe case, okay, because they have at least just only the dengue fever, but don't turn to dengue hemorrhagic fever. So if a dengue fever that the children infect by the primary infection is okay. But if the child has been infected at the second time or the third time with the different serotype of dengue virus, that is very seriously. Okay, it's gonna turn to dengue hemorrhagic fever and put the child in the critical status. You know, it's very severe. Any more questions, please, for the topic? Before ending the session, I have some nice song to give for you. Okay?
Monster Math presents Counting to 10. Okay, class, let's count these munchkins together. 1.
Okay.
I'm thankful for my family. I'm thankful for my friends. I'm thankful for the things I have. The thank yous never end. What are you thankful for? What are you thankful for? What are you thankful for?
The duckies for playing with me. Lammy for making me happy.
Bingo for playing fetch with me. I'm thankful for my family. I'm thankful for my friends. I'm thankful for the things I have. The thank yous never end. What are you thankful for? What are you thankful for? What are you thankful for?
Mommy for making me laugh.
Mommy for making yummy snacks.
For Mom for tucking me in at night.
I'm thankful for my family. I'm thankful for my friends. I'm thankful for the things I have. The thank yous never end. What are you thankful for? What are you thankful for? What are you thankful for?
Daddy for taking us on trips. Dad for teaching me how to swim. Daddy for playing songs for me.
I'm thankful for my family. I'm thankful for my friends. I'm thankful for the things I have. The thank yous never end. What are you thankful for? What are you thankful for? What are you thankful for?
For my sharks for making bath time fun.
For my paints, for making everything colorful. For my blocks, for helping me learn. I'm thankful for my family. I'm thankful for my friends. I'm thankful for the things I have. The thank yous never end. What are you thankful for? What are you thankful for? What are you thankful for?
Seeing the animals on the farm.
Fun in the treehouse.
Playing at the playground.
I'm thankful for my family. I'm thankful for my friends. I'm thankful for the things I have. The thank yous never end.
Alright. So in the midst of the COVID-19 infection, okay?
Okay. Thank you, madam.
Yeah, so we have, so although we in the midst of the COVID-19 infection, right? And we all are struggle to fight with this disease. But anyway, in life we have so many things to thank you for. All right? So I try to encourage one of you to have a powerful mind, okay? To have in Thailand we call กำลังใจ okay? To fight with this disease together, because we see that we live in the same world, right? We are global citizens. We live in the same world, so we need to take care each other. Okay, so for today I gonna finish my talk for today. So hope that you can have more information from the session and apply to use in your own country. And hope to see you on site next time. Okay, so bye bye.
Okay, madam.
Goodbye.
Bye, madam.
Bye.
Thank you.
Thank you, madam.
You're very welcome. Thank you.
Bye.
See you on Monday.
Yes.
Bye. Thank you.
Bye.
Have a nice weekend.
Bye.
Yes, have a nice weekend.
ตรงนี้มีอะไรอีกไหมไม่หรือว่ามีชิ้นตรงนี้เดี๋ยวตรงนี้ก่อนได้ตรงนี้ไปอีกนิดนึงเขายังอยู่ใช่ไหมคะเขาก็ยังอยู่ค่ะได้
กำลังเสียบไป